if you could see what's called a white reflex in the eye, what is that caused by, and how would you diagnose it just from observation?
Most parents who notice that the child has a white reflex in the eye, sometimes it's first noticed in pictures. Occasionally a parent will notice it just because of a certain lighting condition where when the child looks straight ahead, and normally you'll see a red reflex equally, one eye will look a little grayer than the other. But very often in pictures it's noted. The white reflex should be a concern to the parent. Occasionally it could mean that the child just has a different size eye and maybe is more myopic. Even that is an important thing to basically discern. But if a child has a white reflex due to some type of pathological condition, that has to be noted and it has to be taken care of immediately. The biggest concern with a white reflex is to make sure that the patient doesn't have something called retinoblastoma, which is a tumor in children, and it's a malignancy. It is in the retina, and it happens in about 1 in 15,000 births. These children, if they're not taken care of at the appropriate time, could not only lose their eye, but also the actual tumor can spread to other organ systems and bones and can actually be deadly. So you have to determine if a child has retinoblastoma. Also, a white reflex might also indicate something less important, but still an ocular emergency, such as a congenital cataract. It could also be related to something such as retinopathy of prematurity in a child who was born premature. It might also indicate an infection such as toxoplasmosis. It can also be connected to a vascular type of disease of the eye called Coats disease. So there are a number of reasons why a child might have a white reflex in the eye. All of them should be diagnosed, and the determination should be made of what the cause was.
Yes, that should be seen relatively quick.
Yes, definitely. It should be seen quickly.